Okay guys, so in this video we're going to go through some knee mobility exercises you can do in order to improve someone's mobility around the knee if you find that they're a bit tight through there. So we're going to do a couple of tests first, one for the hip flexor, quad and then hamstrings to see again around that knee what is our flexibility like, and then some exercises to improve that. The first one we're going to do is a hip flexor test called the Thomas test. So this is really helpful, important for knees. So Patrick, come over to the edge. Basically, we're going to have him so that his bum crease is towards the edge of that bed. We're going to get him to bring his right knee towards his chest, and then we're just going to relax him down onto the bed so that his head is on the pillow. We're going to make sure that the spine is nice and neutral, and then we're going to have a look and see what his leg does essentially. If you find, again with Patrick's pretty good, he's pretty relaxed there, he's got a nice bend of that knee. So if your rec fem or your quad was tight, what you might find is a little bit more extension through the knee. And then also if the hip flexors were tight, you might find a little bit more lift through here. Quite commonly they're both going to be tight. So again, what you could do in order to see whether it was more hip flexors, if you bring the knee more into extension and the knee stayed high, then it's more likely to be hip flexors because you're actually releasing the tension through the rec fem where it comes over the knee. As soon as you bring that knee bend in there, we're affecting more rec fem. So if that got worse, then you could say maybe it was more rec fem that's contributing to that. But I think a lot of the times it's going to be both areas because they're so interlinked. Essentially, you're just looking for how high is it off the bed, and then if you push down, generally you will get a little bit of this motion going on, and also obviously testing this side to this side. Ideally what we want is for that leg to be nice and flush with the bed, and if it's not, then you're going to suggest there's some tightness there. Okay, so if you come back up, Patrick, and then we're going to get you onto your front form, so lying just flat on your front. So the other test we can use for more quads, I use this all the time because it's really quick, is a prone knee bend test. So it's as simple as getting someone lying on their front, making sure the knees are together. A lot of times people will slide their knees out here to kind of compensate, and then it's literally foot towards bum. I'll often do this, and I want to definitely get my heel to the bum. Okay. Ideally, we'd want to be getting that heel to pretty much touch that bottom. Obviously, if you've got people with any sort of knee pathology, you want to be really careful with this. Go into it slow because you might well find that this is quite a challenging position for them. But again, now I'm testing right versus left and seeing whether there's any difference from right to left, which is more of a quad test. Lastly, what we're going to do, Patrick, onto your back for me, and then we're just going to test our hamstrings. So simple test that you can do, bend the knee up to 90 degrees at the hip, holding under the leg, and just extending up, and as you can see, Patrick's got great flexibility of his hamstrings. A lot of people might be around here, and again, it's more testing right versus left and seeing if there's a discrepancy or an issue there. Okay, so you come back up into standing, Patrick. So the first thing we can do with the knee mobility is work on some of the soft tissue using foam roller techniques. So Patrick, if I get you on the foam roller, we're going to do the quad first. So we're going to go down and do onto that thigh muscle, and literally as simple as getting someone onto that thigh and then rolling from the knee down to the hip. Okay, so as simple as that. Again, I would go for about 5 rolls. Most of the time, the things you need to look out for with this sort of thing is making sure people do the full muscle. Often people will just do really small range of motion. They won't go through that full muscle because they'll have components of it that's quite sore, and so they won't want to do it. Then I go on to the ITB, so if we come round onto your left leg for this one. So now we're going to go outside of the leg, so from the hip down towards the knee. You can do this with the foot over the top as Patrick's doing it there, which is perfect. Or you can also do that with the feet together and the body weight completely off the floor. So then you're working it much harder. Perfect. And then if we come into our adductors, Patrick, so then again we're going to work the inside of the leg. Looks a little bit like you're humping the floor with this one, so you just have to bear with it and go with it. If you're doing this in the gym, you might get a few funny looks, but it's a really good one to do, so I highly recommend it. And then come all the way down to that knee, Patrick, as well. So again, we're making sure that someone's coming all the way down, especially around the inside of that knee. There's often a few real sore spots right into where VMO, or just the medial aspect of the quad, I would prefer to call it. Perfect. Awesome. And then what we could do as well is work a little bit on the calves. Again, around the knee, the calf is important. So the knee and the posterior aspect of the leg as well can be used with the foam roller to improve knee mobility. But again, really come quite high right into that. Again, you've got that popliteus in there as well. So I actually do like going into the back of the knee. Often people do find there's a few sore spots right at the back of that knee. And again, where those calves come up and attach. And so if you've got better flexibility through there, often you'll get better knee extension and you'll get better function around the knee. And so those are the mobility exercises we can do on the foam roller. And then we're going to move on to our more of our mobility exercises. So if we find that there are some discrepancies of the quads, for example, what we could do is, if you lie on your side, Patrick, I love this one for mobilising the quads, and it also will get hip flexors as well. You bring the bottom knee up to 90, and you can have the right hand just onto the knee. So you're just holding that knee there. Then you're going to bring your ankle, and with this hand, you're going to hold onto your foot. The thing that I often cue with people with this is don't let that knee lift up too high like that. So make sure the knee's down. Make sure the hip doesn't roll forwards. And then I want you to extend from the hip. Okay, and now we're really getting that quad and hip flexor as you do that. If you can't reach the ankle, if someone can't reach their ankle, what you could do is use a belt or use a towel in order to improve that flexibility through there. So that's just a simple quad stretch you can do to improve quad flexibility. And if you come onto your back, Patrick. And then for hamstrings, very, very simple one. It's just literally bending the knee to 90 degrees, hold underneath your thigh, Patrick, and then literally lifting towards the ceiling. Okay, and then you're just holding that for 30 seconds. So for both of these stretches, I'd go 30 seconds times 3 sets. Obviously, what we want to do as well is make sure that someone is dynamically flexible. So static flexibility and dynamic flexibility have not necessarily got correlation, and we want someone to be able to move and for their flexibility to be good through movement. So with the hamstrings, we'll stay here for the hamstrings. What I really like, or a really nice exercise, is actually a doorway exercise where you're going to get some static stretching and some dynamic stretching at the same time. So what we would do is Patrick would be lying through a doorway. I'm going to pretend to be the door frame, and he'd come up into a static stretch here, knee nice and straight. Obviously, again, Patrick's got quite good flexibility. You might find people are going to be a little bit lower when you do it. And then you're going to actively keep that knee straight, Patrick, perfect, and then up towards the spot on. And then back down again. Spot on. Perfect. Okay, so that's going to, what you do is repetitions of that movement, where you would do, say, 30 repetitions. So you're getting around 30-second stretch on the left side, but you're also getting that dynamic stretch on the right side as well. So then, if we come into, we're going to come up into a kneeling position, Patrick. Just going to take that bed down. And you're going to face towards the camera for us, Patrick. What I want you to do is bring that mat back towards the bed. And you're going to hook your foot onto the plinth. So at home, you get people using their sofa to do this. So you're going to be all the way down on the floor, Patrick, with the knee. Perfect. Right foot forwards. Excellent. So this pre-stretches the quad and also gets the rec fem stretching, gets the hip flexor stretching. Then what we're going to do dynamically is have the hands in front. Nice straight at elbows, and then you're going to drive the hands towards the ceiling, Patrick. So keeping the knee on the floor. That's it. Okay, so just there, driving up. As you drive those hands up, you're going to get a stretch down the front of the body. What we can also do to add a little bit more to this, squeeze that left bottom as you come up with the hands. Makes it a much bigger stretch most of the time. And we can also add a little knee drive. So I want you to drive the knee forwards, and there we go, and then back. So this is dynamically stretching that calf. Then we can add a little bit of rotational plane of motion. So do the same thing, Patrick, with the hands, but we're going to go, first of all, we're going to do our rotational plane. So we're going to go over that right hand side. That's good. Keeping those elbows nice and straight. Again, Patrick did the classic thing there. A lot of people will want to bend that elbow as they come round because it makes it much easier. If you do those straight arms, it makes it much more difficult and gets a little bit more thoracic rotation involved. Okay, then what we're going to do, relax that arm, Patrick, left arm towards the ceiling, and we're going to come across as you were going to do before. So now we're getting our frontal plane. Okay, so we transverse plane before, sagittal to start with, and then we've got our frontal plane now. And again, it's stretching out in 3 different dimensions. Obviously with that one you could do 10, 15 reps on one side of one exercise, and then do that for the 3 different movements, and then change sides and do it on the other side. So really nice stretch for the hip flexors and quads. Absolutely love this one, it's awesome. The other thing that we could do, so if we come up into standing, so the last thing I want to do is just go through a slightly more functional dynamic hamstring stretch, and that's an exercise called the waiter's bow. So literally you're going to have one hand on the chest, one hand on the lower back, and then you're going to maintain a nice, perfect, so feet position facing forwards, maintain that lumbar arch and then come down towards the floor. So this would be similar to like a Romanian deadlift. So if you've got someone that's struggling with Romanian deadlift, do that wall stretch, so the one through the doorway, and then do this stretch, and if they can do those 2 really well, you're going to find that their form is going to be much better doing a Romanian deadlift. Also for people who are bending a lot and are getting back pain, you're going to find that practicing this sort of stuff really improves that motion. But again, it's going to improve that hamstring flexibility, which is really important, and all of the hamstrings and quads really important for the knee, but also for that lower back. And back up. Perfect. So that's a quick test. We can come back to those tests after for mobility around the knee, and a few quick exercises that you can use in order to improve that mobility.